I'm Heidi Drinker. I'm one of the dietitians here at the health service, and I'm in the community dietetics role. So I do lots of projects both within the health service as well as in the community, just as part of my normal role. And a couple of those different projects, as well as some quality improvement things that I've done, I have put into the health awards. So one of them was some staff health work that I did a bit earlier in my work here about 5 or 6 years ago, and more recently I did some quality improvement work around eating disorder services, and put forward that to the health awards as well. So in terms of people looking to put forward a project to the health awards, I would say don't worry about making it really massive. So some of my things were part of things that I just was doing anyway, and there might have been things that I wouldn't have really considered that went into health awards initially. I think the first one I did, I was asked to put it forward by someone who thought it was worthwhile, and I would never have considered it myself. And that's something that I find when you go to these awards and you're sitting there and you're looking at all of the other projects that happen, you see how much of it they're just little things that people had a good idea and they've just built upon it, but then the outcomes that they've achieved are sometimes really amazing, and they're not necessarily what you call like earth-shatteringly big, taking over massive departments or anything like that. And so that's sort of the advice I'd give, is that if you're doing anything that you think is kind of cool, then you should put it forward. So part of it for me, I suppose, was being able to be self-serving really, but being able to get a little bit more credit for some of the work that you're doing, and getting exposure for the work that you're doing. So sometimes you might be plugging away in your department or in your area or your ward and think that you're doing a really great job, but you might not think that it's being noticed by the whole health service. So it can be a really great way to put forward the hard work of you and your staff or you and your colleagues, to then get everyone to stand up and take notice of what's actually happening and the kind of work that you might be doing that other people don't recognise. But also, I kind of like it as a bit of a scrutinisation of my own work as well. So for someone else, someone from outside that's not within, to kind of look at the work that you're doing and actually see whether it stands up against other things as well. So by entering the health awards, I actually found it fairly easy, and in a way actually helped with my projects as well. So most of the projects that I entered, or two of the ones that I entered, were still going when I entered them into the health awards, and it actually makes you look at what you're doing in your project and make sure it's all well ordered. Are you still evaluating? Have you got these things in place? So it can be a really good double checking kind of thing to put forward your project. And by entering the health awards, it's really just writing down the stuff that you're doing. It's not necessarily hard to apply at all, but it really makes you think about what you're doing and how you're doing it and have you done it in the best way. So I really liked it as a way of double checking that what I was doing was actually on track.
Right.
So if you're thinking that maybe you've got something that might be award worthy, but you're not sure, I would say just talk to people. So talking to Mel, or talking to more senior staff, talking to your NUM or your manager about the project, and then maybe just looking on the internet, looking at the forms. And I think by looking at the entry forms and how you would answer them gives you a really good idea as to whether your project would fit or not. If you've got an answer for everything that's on the form, then your project's worthy. So, you know, even just looking at that and looking at how you would answer those questions in relation to the work that you're doing, and then talking to some of the people around about it, and they're always really willing to help. So I found that a really great part of the process, is that everyone's always willing to help you out, help you get your project maybe a little bit more up to scratch if it needs a bit of help, and even just by basically looking at the forms, looking at those things and knowing, yeah, my project fits all of those things, it ticks all the boxes, I could do it. Yeah, so attending the award ceremony day is always, I actually get really emotional, but I'm one of those kind of people. But it's really great to see the work that happens within your LHD. There is always so many things that are going on that you have no idea other people are doing. So it's really great to sort of, you know, go to those sort of things and see how your projects kind of fit in relation to everything else that's going on, and as well as being there to sort of recognise the other work that's happening. And I often come out of those days with more ideas for more projects. I never have the time to do them all, but yeah, you sort of go and you see work that other people are doing and you think about how that would relate to your role or your area, and think, oh, we could do that, or we could modify it this way and do it. So it's a wonderful way to not only show support to other stuff that's happening, but to get great ideas to do in your own area.
Great.